Delhi has reported 980 COVID cases and 2 deaths in the last 24 hours. The positivity rate currently stands at 25.98%. So there is a slight alarm in the national capital as 980 COVID cases and 2 deaths have been reported in just the last 24 hours. But the authorities have said that COVID-appropriate behavior needs to be continued, needs to be put back in play to ensure that that the COVID cases do not escalate, they do not rise, and this containment strategy continues where people just follow basic COVID protocols, wearing a mask, maintaining distance in public places. Now let's listen in to Rajeev Jayadevan, who's the co-chairperson of the IMA task force. This is what he had to say.
We need to understand that there are two types of effectiveness. Depends on what category you're looking at. You can use vaccines to stop infection or to stop infection from happening. For example, most of us have taken the hepatitis B vaccination, which means that if you've taken a vaccine, you've completed a schedule, you will not get infected by hepatitis B, period. But the other category is you take vaccines with an objective to reduce the severity of infection. That is, even if you pick up an infection, you want to have a mild course and you don't want the disease to get so severe that you end up in the hospital or have bad outcomes. So that's the second category. So the COVID-19 vaccines are excellent in the second category. That is, they stop people from developing what's called a severe course of the disease and reduce hospitalization. But in the first category, right from the beginning, it was quite clear that these vaccines are not going to stop infection for very long. And the reason for that is, it's not very surprising. After you take a vaccine, our body develops what is called an immune reaction to it.
The doctor is pointing out that the vaccination shield that many Indians possess is the strongest defense against the virus, but also maintaining that COVID-appropriate behavior is the need of the hour.